Bueno, les cuento que estoy muy contento de estar en este lugar porque el año pasado hice un curso de terapia hortícola y aprendí mucho sobre cómo se utiliza la horticultura y jardinería para acompañar tratamientos médicos. Y estamos en la Universidad de Florida, en Estados Unidos, en este espacio muy especial en donde se practica la horticultura terapéutica. Y me acompaña Diehl, que es la directora de este programa. Acá vienen pacientes derivados de la universidad, de médicos de la universidad, por ejemplo, del tratamiento de cáncer y otras enfermedades, y también gente de la comunidad que viene a hacer aquí un tratamiento de rehabilitación física, por ejemplo. Así que les presento a Leah. Great to see you.
Nice to see you.
And thanks for your invitation.
We're happy to have you here.
Okay, bueno, dice que está feliz de que estemos aquí. Leah, so what's the work you do here? ¿Cuál es el trabajo que hacen acá?
So we are a therapeutic horticulture program,
Es un programa de horticultura terapéutica.
and we serve different groups of people with special needs or circumstances that we use horticulture as a tool for treatment.
Okay, entonces que atienden a personas que necesitan la terapia hortícola como una herramienta para su cura. Okay. So, how many of them come here? ¿Cuánta gente viene aquí?
It depends on the semester, and it depends on our funding, because the programs are based on grants that we receive. So this semester we have kind of a light group, and light semester we have about 3 groups that are coming for therapeutic horticulture, but on some semesters it could be 7.
Okay. Dice que bueno, depende el semestre y los fondos, porque para llevar adelante este trabajo necesitan fondos, donaciones. Por ejemplo, en este grupo tienen ahora 7 personas que están tratando. How many years have you been doing this? ¿Cuántos años hace que practica esto?
At University of Florida since 2012, but I actually started in horticultural therapy in 1993.
Okay. Empezó desde el 93 y acá en Florida desde el año 2012. What benefits have you seen from the patients? ¿Qué beneficios vio en estos años en los pacientes? Le pregunto.
So many, and I think that we're a unique program here because we do work with a lot of different patient populations. So depending on the group, I've seen improvement of motor skills, eye-hand coordination, those kinds of things.
Dice que vio, por ejemplo, muchas mejoras en la coordinación de trabajo con la mano, de motricidad para personas que tuvieron algún accidente.
And a lot of what we see are improvement of emotional function, psychological function, alleviation of depression, stress.
Por ejemplo, también han visto mucha mejora en el alivio de la depresión, el estrés, mejoras emocionales. Yes?
And I was going to say, the one thing that we really try to do here with all of our groups, no matter what their disability, is help them to understand how nature and plants can be part of their wellness journey.
Y más que nada lo que intentan hacer es que entiendan cómo la naturaleza y las plantas son parte de ese camino de recuperación. Okay. What are the ages of the people that come here? Las edades, ¿no?
Although we do have little preschoolers, come once a year. Our main groups, probably college students, are the youngest. So anywhere from 18 to 25, and then we also have some older adults. So I would say anywhere from 18 to 75.
Okay, desde 18 años a 75 años vienen todos aquí. And they work here in the greenhouse. Trabajan acá en el vivero.
Yeah, this is our primary spot. We do some stuff out in the gardens, but we mostly do our projects here in the greenhouse.
Dice que trabajan afuera, pero básicamente hacen todo el trabajo acá en el vivero adentro. Tell us a case, one person that you've seen a dramatic change. Le pregunto que nos cuente un caso concreto de un cambio dramático. Remember the name?
Yes, I did have a woman named Joy who worked with me. She had just been newly diagnosed with Parkinson's disease when she came here.
Okay, una señora que se llamaba Joy y que fue diagnosticada con la enfermedad de Parkinson.
Understandably, she was very frustrated, very angry. It was changing her life.
Estaba muy frustrada, muy enojada por el cambio de su vida.
And so I think for the first several weeks she was here, we could see a lot of anger and stuff coming out through the way she was interacting with plants.
Y en las primeras semanas vieron mucho enojo y cómo interactuaba con las plantas al principio.
But we really recognized that was part of the process as she was working through the acceptance of that diagnosis.
Y que entendieron que era parte del proceso de aceptar su diagnóstico de Parkinson.
And I think as she did that, she started to let go of some of that frustration and tension, I think.
Y cuando empezó a aceptar eso, se dio cuenta que empezó a soltar esa tensión y ese enojo por el Parkinson.
And I think she slowly felt like she became part of this community. That was a very positive thing for her, and realized how helpful plants were to work through that.
Y lentamente se dio cuenta que empezó a formar parte de esta comunidad y a mejorar en el sentido de la enfermedad, ¿verdad?
Yep.
Y el trabajo con las plantas sobre todo.
And after, a couple of months, we started to see many more smiles, interacting with people, really just being more content with where she was.
Okay. Dice que después de un par de meses vieron que empezó a sonreír, a estar más contenta y a interactuar con todo el grupo. So she changed her emotional sense, but still had Parkinson.
Yes.
Digo que ella no es que se curó del Parkinson, pero sí estaba mejor emocionalmente.
Yeah, and I think that she realized that being part of this group, there were other people, it was a Parkinson's group, so she felt that connection to other people and had that support. But I think she also helped her to understand how plants could help her, not just emotionally, but even with the physical motor skills.
Bueno, y que el trabajo en grupo también le enseñó y entendió que no solo podía mejorar la interacción con el grupo, sino que el trabajo con las plantas le mejoraba su motricidad teniendo Parkinson. Okay, so you remember her?
Very much, yes.
Okay.
Yeah.
Okay, dice que se acuerda mucho de este caso particular. And finally, I don't want to take much of your time. How much do you think people know, not only in the States but worldwide, the benefits of working with plants? Because we are surrounded by plants, but we don't really connect with them as much as we should. Le pregunto, no solo en Estados Unidos, sino en el mundo, ¿cuánto cree que la gente realmente entiende el beneficio de las plantas?
I would say that it's growing, and I think the silver lining of the COVID pandemic was that people were making that connection with nature, outdoors, plants more. I know here in the Florida horticulture industry, people were buying plants like there was no tomorrow. And
Okay.
so I think
Okay, dice que bueno, que sobre todo con la pandemia empezó a haber más interés por el contacto con las plantas y que ahora acá en Florida que la gente compra plantas como si no hubiera mañana, que se fueran a acabar, ¿no?
And I know here we've been contacted by more doctors' offices and clinics that are interested in exploring the use of horticulture for their patients.
Okay, y que cada vez más ve que los médicos de la universidad empiezan a pedirles más información sobre cómo contactar a los pacientes con las plantas.
And I have been doing some work in Singapore, in some other Asian countries, and I think it's really growing there as well. In some, it's been there for a long time, but I'm starting to see it really bloom. That pun.
Okay.
In other countries as well.
Okay, dice que estuvo hace poco en Singapur y que ve como en todo el mundo empieza como a florecer este interés por las plantas. You mean the interest between the benefits from the plants and the practical benefits, not just for social activities, but as medical practice. No solo como una actividad social, sino como una práctica médica.
Yeah, I think what we often see in some other countries is that it starts with a particular population. Like in Singapore, it was older adults, finding a way to get them out of their apartments and interacting, the social part for sure, but also the physical, the walking, the moving, the physical aspect of that as well, which is really important.
Claro, lo que veo por ejemplo en Singapur, cómo mejoran la cuestión física de recuperación de temas físicos. And really the last one, do you think that doctors, science, medicine is believing each time more in horticulture therapy? Le pregunto si la medicina, si la ciencia, los doctores creen cada vez más en los beneficios de la terapia hortícola.
I think that many of them, especially if they already have some kind of relationship with plants, see the benefits, but it's the research that helps them to understand that there's really something behind that. So the more we can do of that, the more I think it's going to be convincing.
The more the doctors see that the therapy works?
Yes, that
Okay.
we've actually, we do some research projects here so that we actually have data, IRB approval to look at certain patient populations and that we've had positive results. I think that's really what's also important.
Ok, dice que los médicos que están en contacto con las plantas evidentemente lo entienden, lo creen y apuestan, pero lo más importante es que están haciendo research, o sea, investigación para avanzar en el cuidado, el mantenimiento del paciente con las plantas. So are there really documents that show benefits? ¿Hay documentos que demuestran el beneficio?
Yes, we just actually finished up a 1.5-year research project with university students with stress, anxiety, and depression. And we found that those students that participated in 7 or more therapeutic horticulture sessions had statistically significant decreased stress, anxiety, and increased academic resilience. Academic resilience, yeah.
Okay, so dice que hicieron un estudio concreto with students.
Yes, with university students.
Con estudiantes de la universidad donde comprobaron que mejoraron bajaron el nivel de
Stress, anxiety,
la ansiedad
and increased academic resilience.
y mejoraron el nivel académico. O sea, they were academically low and they made it
Well,
better.
not necessarily. It's a particular survey that's called the Academic Resilience Scale. So
Okay.
they took it before they started the program, and then again after they finished those 7 or 8 sessions, and the change in the way they rated themselves. So it wasn't necessarily associated with grades, but with their change in attitude, their change in resilience.
On learning.
On academic issues. Yeah.
Okay.
Yep.
Bueno, entonces claro que lo que probaron es que no es que mejoraron las notas, pero sí la actitud académica frente al estudio. Ok, podría hablar horas, pero la vamos a liberar. I could talk hours.
Me too.
Yeah.
Yes.
Thank you.
Thank you very much.
Ella también dice, bueno, thank you very much, and I hope in the future we get more programs like yours.
Thank you very
Y
much.
ojalá haya muchos programas así en el futuro. Gracias.